Well, today on the show, we're at Ocean Springs Hospital of the Singing River Health System, and we're talking about lung cancer, detection, treatment, and first of all, we're talking to pulmonologist, Dr. Bobber. How are you, sir?
Good to see you, Jim.
And it's good to see you as well. Okay. People are diagnosed all the time with lung cancers, you know, those who smoke mainly. What do they do as far as coming to you to get diagnosed?
So, you know, Jim, over the past few years, we've instituted this low-dose CT scans to screen for cancer. It's like screening for prostate cancer or breast cancer. Anybody who smokes gets yearly scans, and the purpose is to catch cancer early. Mm-hmm. And this is something that really didn't exist a few years ago because it hadn't been demonstrated that it actually benefits people. But we've had a lot of research which shows that it helps, and we've been catching a lot of patients this way that we've been able to help.
Now, why do they need to have a CT scan?
So chest x-rays aren't sensitive enough to catch these lesions. And I'm going to show you in just a little bit a lesion that we've recently caught. We can catch them as little as a centimeter. And if you catch it at that stage, which is what you want to do, this is curable. You know, this is very treatable at that stage.
Now, cancer, I mean, it's something that you know, most people think is a death wish, but it's not necessarily.
No.
Now, how does someone qualify to get the CT scan?
So it's usually people who've been smoking for, we call it 30 pack years, but to give you an approximation, 30 years of 1 pack a day. That puts you into that category where we would be screening you. Insurance pays for people between 55 to 77 years of age. So in that window, if you fall, and if you've been smoking within 15 years, we're going to scan you every year.
Wow.
For that. Some people might want to get it done, you know, if they're outside the window, but they just want to be sure. And the CT scan is affordable, it's cheap. Unlike other scans, this particular scan is quite affordable for people, even if they pay out of pocket.
Okay. Show us, if you would, please. I believe you had some...
so if I can just pull this up.
Okay.
So this is a lady, and I want to show you her scan a year ago. So this is October 2018. This is her right lung and her left lung and her trachea. And you can see that there really wasn't very much. These little dots are just vessels. And then on the 21st of October, we look at this scan, and we see this little area out here. This measures less than a centimeter. And this is precisely the sort of thing we're looking for, and we were able to biopsy this and find out that this is very early stage cancer.
Wow. And now you're able to, once you see that,
right,
set up a program of treatment as well as surgery.
Right. So once we find something like this, then we have a discussion with the patient about biopsying it. And the biopsy can either be done through a needle biopsy by the radiologist, or we can do it through bronchoscopic techniques. And bronchoscopy is basically a camera going down your lungs. And this is where we do it. And all the equipment you're seeing right now helps us do this. So here is the anesthesia machine. The patient is usually completely asleep when we do this. They don't feel anything at all. This is our state-of-the-art navigation equipment. And basically what it does is, you can see in this case, we've got a little spot up here. And using software, we can actually form a path that just tells us where to go. And once we've got this path established, we can actually use it when we're doing the bronchoscopy to get into that lesion. And so this is really the latest technology that we're applying to diagnose these patients.
Okay, well, we want to talk about surgery now and go and check the Da Vinci unit that they have here at Singing River Health System in Ocean Springs with Dr. Williams. Dr. Jason Williams is the thoracic surgeon here. Sure. Now, we just talked to Dr. Bobber. Now, it's being diagnosed. Now, what happens when they get to you?
Right, so it's a great question. So before we ever talk about taking someone to the operating room, we as a group of oncologists, surgeons, pulmonologists, pathologists, and radiologists meet as a tumor board, a multidisciplinary tumor board, and we discuss each patient that comes to us with a diagnosis of this type, some kind of a cancer or a mass inside of the chest, to try to determine the best course of action for that individual patient based on their individual needs. If it's decided that surgery is in their best interest, say they have a lung cancer, it's resectable, and that patient is in good shape for surgery, The next step will be to be evaluated in our office and then ultimately bring them into this room here, which is our surgical suite that houses our Da Vinci XI robot surgical system. And this system, this is the most advanced robotic surgical system on the planet. And we're very fortunate to have that here at Singing River Health System. We have one at Ocean Springs Hospital and another at Singing River Hospital. And what you're seeing here, these 4 things are the 4 robot arms that we actually put inside of the patient. So if a patient were sitting or, laying on this operating room table, these trocars and these robot arms would actually be inside of the patient's body.
Wow.
And so these arms are doing the work of the hands of the surgeon, but the surgeon is controlling everything. And so what I want to do is walk over to the console and show you exactly how that works.
Okay.
Once the patient gets set up on the table, and once all of the robot arms are placed inside of the patient, the surgeon will come and sit down here at this console. And what we're seeing here is, this is the eye center, and that is a 3-dimensional camera view of what's going on inside of the patient's body. And that 3-dimensional view with gives us an incredible vision of the things that are going on inside of the patient's body, and allows us to see with precision so that we can accurately do the procedure that needs to be done. Down here, we will put our fingers into these devices. This is our right hand control, this is our left hand control, and those controls move the robotic arms that you saw over on the patient. Underneath, there are foot pedals that also help control different things that we use in the operating room as well, whether it's staplers or electrocautery or different things that we use to help assist us with the operation. So what I'm going to do, I'm going to act like the surgeon. I'm going to sit down here at the console, and let me show you how the robotic arms work. All right, so what I am doing now is I'm controlling the scissors with my right hand and this grasper with my left hand. And if I want to zoom in with the camera, what I'll do is I'll make the camera zoom in with my foot pedal and with my hands. And you can see on the screen there how those arms are moving inside of the patient. And with precision here, I can use these scissors to basically cut a very straight and precise line down this paper. And if you can imagine that this is the inside of the patient's body, we want to have a lot of precision when we're dealing with very important anatomic structures. And that's what this robot allows us to do. It magnifies everything going on inside of the chest. It gives us 3-dimensional capabilities. It allows us to do fine microscopic movements with our instruments and with our hands. And it allows for small incisions and a quicker recovery time, all of which benefit the patient.
Go to the website and see what you can do if you need to be treated for lung cancer.